Welcome to this lecture on fetal circulation. This lecture will cover the main circulatory pathway within the fetus, what happens to that pathway at the time of birth, and then the changes that do occur at birth, how do they remain in the adult anatomy. So the take-home messages or the learning outcomes for today's lecture. Firstly, we want to know, where does the mixing occur? So where does arterial and venous blood mix? And there are going to be 5 mixing points. So that's the first one. The second one, what are the shunts that in the fetal circulation? There are going to be 3 shunts. The third outcome is, what are the changes, the 5 changes that occur at birth to the circulation? And then the last learning outcome is essentially, from those changes, what are they now in the adult anatomy, in the adult body? So let's get our orientation firstly. This picture here, so we've got a few things. We've got the liver sitting here at the front. So we're looking in at the embryo or the fetus. Here's the liver. And we've got a quite enlarged heart here, just so we can see a lot more detail. And then off the side we have the liver. We've got a whole lot of blood vessels. So this is going to be the right atrium, the right ventricle, left ventricle, and up there, the left atrium. Some big blood vessels going out. Sitting out here would be the placenta. So sitting here is going to be the umbilicus. So that's going to go out to the placenta. So this is essentially a frontal view in at the fetus. Now this view, this is a sagittal view, so we're looking in at the fetus. This is the head end, tail end, this is the yolk sac, this is the placenta. You've got 2 vessels that you can see, being the red and the blue. The red are the arteries. So the main arteries of the fetus at this point in time, we've got the artery that's going to go into the head, and this is going to be the anterior cardinal artery, with some of the aortic vessels in here. They're going to supply the head and neck. Coming down the back is going to be the abdominal aorta, and then going down to the posterior cardinal arteries. Coming out to go to the placenta is going to be the umbilical arteries. There's 2 of those. And then another final vessel, main final vessel, is going out to the yolk sac, and this is the vitelline artery. The yolk sac bulges out quite significantly at the early stages of embryogenesis, but as it develops further and further, it kind of gets incorporated into the small intestine. So that vitelline artery will become more the anatomical vessels that you're accustomed to being associated with the intestines. So that's the vitelline artery. Going to the blue, a lot of those words just essentially parallel the arteries. So this is going to be the anterior cardinal vein, posterior cardinal vein. Coming down to here, we've got the vein that's draining the placenta. So that's going to be the umbilical vein. Now there's usually, it starts off with 2, but we lose one and we're left with the left umbilical vein, which is this one in here. And then we drain the yolk sac by the vitelline vein, and this is going to come into here. Important thing to note here, however, all the veins kind of have a confluence right in this point here, and this is essentially where they all merge together, and that's almost at a place that they call the sinus venosum. Now where that would be is really about there, so just superior to the liver. That's important because as this starts to develop and incorporate changes for the intestine, and as the umbilical vein changes, that's going to change the way that the circulation goes through the liver. Okay? So I will always refer back to this as best I can as we're exploring the circulation in this image. So in the fetus, the blood, the nutrient-rich, oxygen-rich blood is going to be coming into the fetus from the placenta. The placenta is kind of an exchange mechanism between the mother's blood and the fetus blood. Her oxygen will go in through the umbilical vein, or the blood from the umbilical vein, cross over, and that will then go into the fetus, do all its thing within the fetus, and then the oxygen nutrient pore is going to go back out the umbilical artery back to the placenta, and the whole cycle occurs or continues. So essentially the blood's going to be coming in to the fetus, okay, in the umbilical veins. There's 2, as I said to start with. The saturation's about 80%. So the oxygen saturation of the blood as we go into the body or into the fetus is about 80%. Now, the umbilical vein, as I said, there are two. There's a left, or there's a right and a left. Okay, so this is going to be the left, this is right. Okay. Now, as the liver starts to develop, the liver actually grows out of the foregut and it grows up into the diaphragm. The diaphragm would be sitting kind of here. As it gets bigger and bigger and bigger, it takes up more space, and that makes it harder for the vessels that's trying to get through, which is in this area, through. And now we do know that the blood that's coming from the mother is oxygen rich and it's nutrient rich, so we don't really need to put it through the liver at this point in time. The vitelline vein will have to go through, but the umbilical vein doesn't really have to do it a great deal. So what we do is we shunt it through. Okay, so a lot of the blood will get shunted straight through, as we can see, straight through the liver. And this shunt, this is the first shunt, this is called the ductus venosus. So it goes straight through the liver, or a majority of it goes straight through the liver as a duct, and that's the ductus venosus. Now, the vitelline veins will kind of come in as two as well, but the way that they change is you actually maintain a right vitelline vein, and you then drop off your right umbilical vein, and you maintain a left umbilical vein and drop off a left vitelline vein. So the vitelline vein that remains is going to be essentially the superior mesenteric vein and the splenic vein. Okay? And together they give you the portal vein. That vein will actually go and perfuse through the liver because it's draining the intestines. However, the umbilical veins, which we've lost the right, so we've only left with the left now, the left doesn't really need to go through the liver, but a touch of it will, and this is the actual first mixing point. So the first mixing point is going to be in the liver, in the sinusoids. Okay? Continuing on as the umbilical vein will come in now and sit into the inferior vena cava. So it will go into the inferior vena cava. One point I will say, there is actually a valve in here. There's a valve in the ductus venosus, and that's important because that will prevent too much force of blood going through and getting forced through that ductus too fast. So think about it. In the uterus, or the placenta, which sits in the uterus, if the mother's uterus contracts, it's going to force blood through quite quickly, which can essentially cause a lot of damage if it goes up into the heart and causes all sorts of problems to the heart. So we've got a valve there that stops too much force going through. So there is a valve there. Now, coming up from the legs of the fetus, so coming up from below, is we've got this vein coming up like this. So at this point, this is called the posterior cardinal, but once we're in the developing fetus, we can probably just call it the inferior vena cava. The inferior vena cava will actually go behind the liver, okay? So it's going to go behind, not through it, and it's going to meet up with the ductus venosus. So now we mix those two. So that's the second mix-in. First mix-in is in the sinusoid, second mix-in is in the inferior vena cava. Now we continue on. So now at this point 2, we've got the ductus venosus blood and we've got the inferior vena cava blood. This is going to continue up, and now we enter into the heart. Now this is important to note. In the right atria, we've got the blood coming in from below, which we've just done, but we've also got blood coming up from the head and arms. So this is going to be coming in like this through the superior vena cava. And the blood saturation is probably going to be less than 70% here. So this is, in comparison to this blood, not as good. Okay, so it's probably even going to be less than 70%. So it's going to come in. You don't really want to mix that too much. It will mix, however, and this is the third mixing point. But the majority of this blood will be deflected straight down into the right ventricle. So a lot of that poorer blood will go straight into the right ventricle. Now the better blood, the 80% saturated blood, is going to be wanting to be orientated to go straight across to the left atria. So right across to the left atria. Now there is a septum in here. There's two main septums. There is the septum secundum that will come down and the septum primum that will come up. But they aren't together, so there's actually a hole there. Okay, so the primum kind of sits more to the side and the secundum sits more like that, which gives us a hole. And this hole is called the foramen ovale, being oval shaped. And that allows the second shunt to occur. The first shunt, I'll put this in red, the first shunt being the ductus venosus, the second shunt being the foramen ovale. So the good blood will go straight across into the left atria, directed straight through between those two septums. So let's stop there for that point. So we've got good blood sit in the left atria. We'll continue on with the bad blood down here. So the bad blood coming from here is going to be down here. As the ventricles contract, this blood will get shot out of the pulmonary artery or pulmonary trunk to want to go to the lungs. I haven't drawn a lung on this side. So it's going to go into, it wants to go into there. However, the lung is all collapsed up. So all the blood vessels into it has been compressed in. That means that the pressure in these pulmonary arteries is very high. So the blood doesn't really want to go into those two lungs very well. So most of it will get diverged straight into the aorta. This is the aorta here. Through the last duct or the last shunt. This is shunt 3, which is the ductus arteriosus. Don't get it confused with ductus venosus. This is ductus arteriosus. So it's going straight from the pulmonary trunk straight into the aorta. Remember, this is the poorer blood, straight into it like this. Now, so that's an important concept to know. So that's going to go into there. A bit of blood will go to the lungs, a small bit of blood will go to the lungs, and that will come back into the pulmonary veins. So we will have the fourth mix in here of blood. So there will be a bit of blood coming back into the left atria that mixes with that good 80% blood, but the majority will shunt across. From this blood, it's just going to go down into the left ventricle, which we could have guessed. So into the left ventricle, and then from there we contract it out into the aorta. Now this is a very smart system here because that good blood, the 80% saturated blood, is going to come out of the aorta. The first branches, remember some of the first branches to the heart is going to go to the heart itself through the coronary vessels. So the heart itself is going to get really good blood. The next vessels, the brachiocephalic, which is going to go to the right side of the body to give head and arms. The next one's the common carotid, which is going to go the left side, head, arms, brain. And then the next one is left subclavian, arms. So the rest is going to come around here where it meets that blood that's come from the right ventricle, which was not so good. And that's going to be the fifth mix-in. And from there, that blood will continue down the arch of the aorta, thoracic aorta, which is here. And down we go, down to the body, going out to some will go out to the intestines through here, and the rest will come down. Some will go down to the legs through the external iliac artery, but the rest will come out, which is out here, go out to the placenta as the two umbilical arteries. And that's going to go back, reperfuse, pick up the new oxygen, drop off the toxins and pick up the new nutrients, and then we do a whole cycle again. So that's essentially the fetal supply. We've seen the three shunts, ductus venosus, the foramen ovale and the ductus arteriosus, and we've seen the 5 mix-in points, one in the liver, one in the IVC, one in the right atria, one across in the left atria with the lung blood, and then finally in the arch of the aorta in that's the fifth mix-in. So that's essentially the fetal supply. That's how it occurs for the whole 9 months. And then we move to birth. So what happens at birth? The first thing that happens when the baby is born is that the baby takes a deep breath, probably to cry. So the first thing that will happen there is the lung will get big. So as the lung expands, Okay, the lung expands. When it gets bigger, the vessels in it will get bigger with it. So that means that the pressure in the pulmonary trunk drops dramatically. So that allows blood to now kind of move more likelihood to kind of go into the lungs. So more blood's going to go and perfuse the lung. So blood's going to the lung, more goes to the lung. That means it's got a less likelihood to want to go into the ductus, into the aorta. It's more likely to go into the like that. So that's the first change is, I'll do this in a different colour, I'll do this in blue. Is lungs expand, blood goes to lungs. That means that the blood is then going to return to the left atria. So we're going to have more blood returning now to the left atrium. At a similar time, these vessels here are going to start to close off. So the umbilical arteries will start to close, start to vasoconstrict. Okay, that they won't completely shut, but they will start to close off. It's important to note that this needs to happen first because you need to drain the placenta, because you want to keep this one open and close this one off first, so there's no blood returning to the placenta, but the rest of the blood in the placenta will drain off. So that will occur like so, and then slowly less blood, less blood, less blood, until this one will start to close off. Okay, so that's the second change, third change. And then obviously when the baby's born, you're going to clamp off the umbilicus or the umbilical cord, and then that's going to prevent any more blood moving through. Now, with less blood going back up to the right atria, that means that there's going to be more blood on the left side than the right side. That means that the pressure, which was normally in the fetus, pushing blood, higher pressure going that way than that way, that kept these open, the two septum open. But now the blood's pushing back because a lot more blood's going into the left atria from the lungs. So it's going to push the primum against the secundum, which is going to cause this to close off. So we close the foramen ovale, and that now closes off completely. Okay, so that should be pretty much fibrotic at about 1 year of age. Now, in about 1 in 6 people, 1 in 5 people, that is still open. So they still have a patent foramen. So that's the fourth change. And then lastly, because we got good blood coming back, good oxygenated blood, so instead of 80% now, it's coming from the lungs, so it's going to be 97%. So the blood that's coming back from the lungs is going to be really highly saturated. The blood's going to go down the left ventricle and out the aorta, but because the left side is now more powerful or got more pressure, blood goes the opposite way, back the opposite way through the ductus arteriosus. And once it goes back down that direction, which is not going to be good. But because the oxygen is so high, the muscles in the ductus arteriosus, which is smooth muscle, it constricts to a high amount of oxygen. So that's going to start narrowing off. As well as the lung itself releases a chemical called bradykinin. The bradykinin will go into the blood, and as it's moving through the ductus in that direction, the bradykinin will cause vasoconstriction there as well. So essentially 2 things: high oxygen, which is the oxygen, when we're in a lower oxygen state of about 80%, the ductus arteriosus releases a chemical called prostaglandin. But as the oxygen increases for once the lungs open, that prostaglandin drops off. Prostaglandin is important for keeping the ductus arteriosus open, but with the oxygen being high now, it's going to drop the level of prostaglandin, which is going to constrict. The oxygen content is going to cause it to constrict, and the bradykinin is going to cause it to constrict until the whole thing is now closed off. And that's the last change there, which is the closure of the ductus arteriosus. So just a take-home point, when the baby's born, the first thing that happens is the lung opens, more blood goes to the lungs, okay? The umbilical arteries close off, so they constrict. The umbilical vein closes off and constricts. The fossa, or the foramen ovale, closes, okay? Now there's no more hole, so the blood can only go in the right ventricle. And then finally, the ductus arteriosus will close, so there's no blood movement between the aorta and the pulmonary trunk. So that's the birth changes. Now, what happens in the embryo, or what happens in the adult now, or what happens to these structures in now the adult body? Well, as we've seen at the umbilicus level, so this is going to be the umbilicus. Okay, so this is the front anterior wall. Okay, all of that will fibrose. Okay, and that will go into a ligament. So the ligament of the front of your liver is the falciform ligament. Okay, now if you follow the falciform ligament of your liver down, it will come to a lower edge, and that's what we've got there, and that's what we call the round ligament, or the ligamentum teres, and that's the remnants of the umbilical vein. Okay, if you look underneath, behind the liver, you might be able to see kind of where the ligaments come around, and that's kind of the point of the ductus venosus, and that's going to be the ligamental venosus. Okay, that's a remnant there as well. As we move up into the heart, that foramen ovale is now closed, so now it's just a fossa ovale. So that's completely closed. And then finally, this ductus arteriosus is not a duct anymore, it's a ligament. So that's the ligamental arteriosus. And then finally we move down here, and essentially what happens, these become all ligaments. So there's two ligaments, because there's two vessels, remember? So it's going to be a right and left, not umbilical artery anymore, but it's going to be called the medial umbilical ligaments. Okay, medial, not median. The median is a separate ligament. So the two right and left medial umbilical ligaments. Okay, but where this, at the proximal end, where this is like so, this part is going to stay as a patent blood vessel. It's going to be probably the first part of the internal iliac artery, this part here, but probably this part here is going to be what we call the vesicular, superior vesicular. Vesicular means bladder. Superior vesicular artery, which is going to probably supply the bladder and the distal part of the ureters. Okay, so let's just do a final take-home message or point. The three shunts, because this was the learning outcomes, the three shunts is the ductus venosus, the foramen ovale, and ductus arteriosus. Where the 5 mixing points are in the fetal supply, the first one's in the liver sinusoids, second in the IVC, third in the right atria, the fourth in the left atria, and the fifth in the aorta, between the ductus or the pulmonary trunk and the aorta. And then the changes that occur, lungs open, more blood goes to the lungs. The shift goes from now the left becomes high pressured, the right becomes less. The umbilical arteries will close, they close off. So will the umbilical veins, okay? And then finally the foramen will close and the arteriosus will close. And the remnants, and that's the 5. The remnants that's left over is we've got the 2 medial umbilical ligaments, and the other remnants is the superior vesicular artery, the teres ligament, which is that round ligament which goes into the falciform ligament, or the lower edge of the falciform ligament. Around the back is the ligamentum venosus, which is that remnants of the ductus arteriosus. And then finally we've got the fossa ovale, and the ductus arteriosus is now the ligamental arteriosus. So hopefully that's a lot to take in, but hopefully now you understand how the circulation worked in the fetus and why we have these strange structures now in the adult structure, which were essentially just the remnants of our blood supply in the fetus.